Long-term and community-based care settings are facing unprecedented challenges due to the COVID-19 pandemic. People living with dementia are particularly vulnerable to complications due to their age and other medical conditions. And right now, you may be taking on additional responsibilities and unfamiliar roles while providing this vital care. You have an important job in helping this vulnerable population. The purpose of this video is to provide tips and guidance to help you provide person-centered care to individuals with dementia. It's likely that a significant percentage of the people you care for are living with dementia. More than 5 million people in the United States have Alzheimer's, including nearly half of all nursing home residents, and more than 4 in 10 people in residential care communities, like assisted living. Many people with dementia receive community-based care. 32% of these individuals use home health services, and 31% use adult day services. Alzheimer's is a brain disease and is the most common cause of dementia. Dementia significantly impacts a person's memory, thinking, and behavior. Dementia-related behaviors are not intentional. As Alzheimer's disease progresses, the individual's need for support, particularly with activities of daily living, will increase. During a crisis, people with dementia may become more confused, frustrated, or even display an increase in dementia-related behaviors. But there are steps you can take to ensure their needs are met. In this video, we'll cover providing person-centered care, preventing illness, helping families and friends stay connected, assisting with eating and drinking, monitoring walking and unsafe wandering, and observing and responding to dementia-related behaviors. One of the most important steps you can take towards providing quality dementia care is to know the person and treat them as an individual with unique needs, even during an emergency. This helps you form a close, supportive relationship based on respect, where you understand their point of view. Having a personal information form readily available that includes important details about a person can help maintain a stable and comforting environment. Some details you should include on the form are normal daily structure and routines, hobbies and interests, things that upset or calm the person, and the names of family and friends. Communicate regularly with other members of the person's care team, such as through briefings at the start of a new shift or during daily huddles. Be sure that the person's advance directives are up to date and follow the person if a transfer is necessary. A person living with dementia may have trouble following instructions or practicing careful hygiene that helps prevent the spread of illness. Using a person-centered approach, you can help prevent illness by reminding the individual to routinely wash their hands, possibly on a supervised schedule, cover their nose and mouth when sneezing or coughing, stay in a particular area, take their medications, and practice social distancing. Individuals living with dementia may need help staying in touch with their families and friends during a crisis. For those in a residential care setting, such as assisted living, families might schedule a phone or video call, or send notes and photos. Consider developing a What You Should Know fact sheet for family and friends that explains how they can get updates or talk to a care provider during an emergency. Remember that each family is unique, and for some people, their closest supporters may not be biological or legal family members. People living with dementia may need to be reminded to eat and drink, as they may not be able to recognize hunger or thirst. They may also need assistance with eating and drinking. Sometimes just sitting and talking with the person at mealtimes may help improve intake. If the person is at risk for choking or has a history of swallowing difficulties, it's important that they be monitored by a trained staff member. Walking can be great exercise for people with Alzheimer's or another dementia, but wandering, which is common for people living with the disease, can be dangerous and possibly life-threatening. 6 in 10 people with dementia will wander, and many do so repeatedly. Unsafe wandering is when a person with dementia gets lost, enters inappropriate places, or leaves a safe environment. The risk for unsafe wandering may increase when the person is faced with a stressful situation. Here are some examples of ways to ensure that people living with dementia have opportunities to maintain mobility and strength in a safe environment. Provide the person with safe spaces to walk. Secure the perimeter of their environment if possible. Ensure the person gets regular exercise. Provide structured activities throughout the day, and spend time outdoors if possible. Behavior is a form of communication, and dementia-related behaviors, such as hitting or screaming, are the result of changes in the brain caused by Alzheimer's disease. It may be that the person is having trouble expressing their thoughts, feelings, or an unmet need. As a care provider, the best thing you can do is observe and try to understand what the person is trying to communicate. Some potential reasons for dementia-related behaviors include pain, hunger, fear, depression, loneliness, helplessness, and boredom, changes in routine or environment, and a lack of familiarity with personal protective equipment such as masks. When you encounter dementia-related behaviors, here are a few strategies that may help. Rule out pain, thirst, hunger, or the need to use the bathroom. Speak in a calm voice, and consider moving the person to a quiet area. Look for the feelings behind the words. Affirming the person's emotions may help calm them. Offering reassurance without challenging their words can be effective. Remember that every interaction is a chance to connect with the person, so be sure to put the person before the task at hand. For more guidance on responding to dementia-related behaviors, visit alz.org/professionals-COVID. Crises can be challenging, especially for individuals living with dementia. By taking a person-centered approach to care and being ready to respond appropriately to dementia-related behaviors, you can feel more confident that you're meeting the person's needs. Thank you for rising to the challenge during this difficult time. With more than 70 chapters across the country offering information, support, and resources, the Alzheimer's Association is here to support you. To learn more about the topics covered in this video, visit the Alzheimer's Association website and access these informative resources.